about behaviour that is linked to a cognitive impairment is likely to be prenatal alcohol exposure. From the research that I've done, I can see that both have clear implications for the individual and his or her family. Both can cause epigenetic changes in future generations. The difference to me is that while they can both cause brain differences and these epigenetic changes, which can impact on the health and well-being of future generations, only FASD is a whole-of-body condition that includes physical changes, not just in the brain, but in the whole of the body, including hearing, vision, heart, kidneys, skeleton, etc. In adults, the consequence of trauma is called PTSD. In children, it's called developmental trauma disorder. The body keeps score of all these traumas and they end up stored in the DNA. I don't know any child with FASD who doesn't have some level of trauma. Even when the child is in a loving, stable biological home with no moves, as they grow, it's likely that they'll experience ordeals which can come from school, peers, being bullied, constantly getting into trouble, becoming involved in the criminal justice system, using drugs, being in unsafe environments, or being kicked out of home, and the many other negative experiences that people with FASD seem to attract. As a small child, Seth was a happy, joyous little lad. And in hindsight, I can see the progression from this little fella at 5 through to 10 and through to 15, and see how his whole demeanour changed. I think that I can almost visualise where his trauma started, and it was between the ages of about 10 and 13. Things started to go wrong at school. He was bullied. He realised he didn't understand social situations. He was rejected by peers. And it was in fights, and for any child wanting to fit in, that's trauma. There are many factors influencing the development, attachment, intelligence and cognitive abilities of a child. And what we know now is that these factors will start prior to conception, and they start in the DNA and epigenetics of the parents. Then it's the whether mum and dad have used drugs or alcohol at conception, and then the alcohol situation and drug situation during pregnancy, including the nutrition of the mum, and as we know, height and weight, whether she's in a domestic violence situation. All of those things factor in to the child development or the development of that fetus. And then, of course, when the baby's born, what sort of environment he or she is born into, any secondary smoke, any violence, anger, what the child's nutrition is like, and then as we go through school, all those other issues will impact on the child. Whether they impact sufficiently to cause trauma is another matter, but still, there are so many more things now that when it comes to having a child and having a child who is not affected by some of these things than we ever thought before. And we really have to wonder whether FASD is in fact 100% preventable. Right. According to experts, trauma in children can be seen in behaviour that appears to be disorganised, chaotic and agitated. Individuals and families who do not come to terms with the traumatic experiences are likely to pass on these unresolved trauma issues to their children. Childhood trauma can be hidden or stored in the brain circuits and later activated by adult stress or trauma, particularly that which occurs in relationships. Studies on trauma and the connection to parenting have shown a link between childhood distress and substance abuse, which isn't really hard to understand. In my experience, trauma leads to anxiety, and unmedicated or unresolved anxiety leads to substance abuse issues. Psychological pain produces feelings of powerlessness, vulnerability, frustration and confusion. This destabilises a person's sense of self and affects identity. The magnitude of pain, rage and grief of unresolved suffering continues to haunt families and communities into present times. Unfortunately, it's naive to think that people will just get over trauma. They won't. Brain areas implicated in the stress response are the same areas that are implicated in prenatal alcohol exposure: the amygdala, the hippocampus and the prefrontal cortex. Traumatic stress can be associated with lasting changes in these areas and is associated with increased cortisol and norepinephrine responses to subsequent stresses. Antidepressants have effects on the hippocampus that can counteract the effects of stress. With FASD, as you all will know, we medicate for the symptoms, hopefully in consultation with a psychiatrist. So the notion that trauma ends and FASD begins seems to be erroneous. They are intertwined like strands of the same rope. But what comes first? Well, prenatal alcohol exposure traumatises the fetus, so my guess is that, again, there is no separating them. While there are drugs and alcohol on earth, there will be trauma. And where there is trauma, we will be trying everything to alleviate the feelings that it produces. In a world of hope, alcohol and illegal drugs have disappeared from the face of the earth, and parents will leave no baggage for their children, and children will never have to experience family violence or any negative situations without an understanding and compassionate loved one to guide them through, remembering always that our physical body keeps tabs on what happens to us psychologically. Thank you. I hope that's helped. That information is this video is going to be put up on YouTube, so if anybody wants to have a look at it later, please do. If anybody wants to ask me any questions about trauma, I've actually made contact with some trauma specialists and some specialists in trauma and FASD overseas, so if I can't answer, which may be likely, then I can certainly get an answer for you. So thank you very much. If you want to contact me, my number is 0412 550 540, or you can email me on elizabeth@rffada.org. Thank you.